Word parts are the key. Learning medical terminology is much easier once you understand how word parts work together to form medical terms. This book includes many aids to help you master this skill. The types of word parts and the rules for their use are explained in this chapter. Learn these rules and follow them. To continue reinforcing your word-building skills, each time a term made up of word parts is introduced, the definition is followed in parentheses by the word parts in red with their meanings. And after Chapter 2, there is a word part review section. This provides additional word part practice and allows you to evaluate your progress toward mastering the meanings of these word parts. The learning exercises for each chapter include a challenge word-building section. These will help you develop your skills in working with word parts. The 3 types of word parts. 3 types of word parts may be used to create medical terms. Word roots, also known as combining forms, contain the basic meaning of the term. They usually but not always indicate the involved body part, and suffixes usually but not always indicate the procedure, condition, disorder, or disease. A suffix always comes at the end of a word. Prefixes usually but not always indicate location, time, number, or status. A prefix always comes at the beginning of a word. Word roots, combining forms. Word roots, also known as combining forms, act as the foundation of most medical terms. They usually, but not always, describe the part of the body that is involved, Figure 11. Some word roots indicate color, as shown in Table 12. Combining vowels. To make the medical term easier to pronounce, a combining vowel may be needed between the word root and the suffix. The rules for combining vowels are explained in Table 13, and the letter O is the most commonly used combining vowel. When a word root is shown with a backslash in a combining vowel, such as cardio, this is referred to as a combining form. Cardio means heart. Word part guidelines. 1. A single word root, combining form part, cannot stand alone. A suffix must be added to complete the term. 2. The rules for the use of combining vowels apply when adding a suffix. These rules are explained in Table 13. 3. When a prefix is necessary, it is always placed at the beginning of the word. A word root combining form usually indicates the involved body part. Spinal cord, mellow, bone osto, bone marrow, myelo, nerve, neuro, joint, arthroso. Word roots indicating color. Cyan O means blue. Cyanosis is a blue discoloration of the skin caused by a lack of adequate oxygen. Cyan means blue and osis means condition. Eryther O means red. Erythrocytes. They are mature red blood cells. Erythro means red and cytes means cells. Leuco means white. Leukocytes are white blood cells. Leuco means white and cytes means cells. Melano means black. Melanosis is any condition of unusual deposits of black pigment in different parts of the body. Melan means black and osis means condition. Polio means gray. Poliomyelitis is a viral infection of the gray matter of the spinal cord that may result in paralysis. Polio means gray, myel means spinal cord, and itis means inflammation. Rules for using combining vowels. 1. A combining vowel is not used when the suffix begins with a vowel a, e, I, o, u. For example, when neuropo, nerve, is joined with the suffix itis, inflammation, the combining vowel is not used because it begins with a vowel. Neuritis, neuritis, is an inflammation of a nerve or nerves. Neur means nerve and itis means inflammation. 2. A combining vowel is used when the suffix begins with a consonant. For example, when neuro, nerve, is joined with the suffix plasty, surgical repair, the combining vowel o is used because plasty begins with a consonant. Neuroplasty, neuroplasty, is the surgical repair of a nerve. Neuro means nerve and plasty means surgical repair. 3. A combining vowel is always used when 2 or more root words are joined. As an example, when gastro-o, stomach, is joined with enter-o, small intestine, the combining vowel is used with gastro. However, when the suffix it is inflammation is added, the combining vowel is not used with enter-o because it begins with a vowel. Gastroenteritis is an inflammation of the stomach and small intestine. Gastro means stomach, enter means small intestine, and itis means inflammation. 4. A prefix does not require a combining vowel. Do not place a combining vowel between a prefix and the word root. Commonly used word roots, combining forms. Because word roots, combining forms, describe body parts, Most of them are specific to body systems. And many of these combining forms are introduced in this chapter and in Chapter 2. Learning these word roots now will make your study of the other chapters much easier. Suffixes. A suffix is added to the end of a word root to complete the term. Suffixes usually, but not always, indicate the procedure, condition, disorder, or disease. For example, tonsil O means tonsils. A suffix is added to complete the term and tell what is happening to the tonsils. Tonsillitis is an inflammation of the tonsils. Tonsil means tonsils, and itis means inflammation. A tonsillectomy is the surgical removal of the tonsils. Tonsil means tonsils, and ectomy means surgical removal. Suffixes, meaning pertaining to. Some suffixes complete the term by changing the word root into an adjective, a word that describes a noun. As an example, cardiac means pertaining to the heart. Cardi means heart, and AC means pertaining to. Many of these suffixes are defined as pertaining to. To make such suffixes easy to find, they are listed together in a table at the beginning of Appendix A. Suffixes as noun endings. Some suffixes complete the term by changing the word root into a noun, a word that is the name of a person, place, or thing. As an example, the cranium is the portion of the skull that encloses the brain. Crani means skull, and is a noun ending. Other suffixes in this group are defined as noun endings. These suffixes are also listed in a table at the beginning of Appendix A. Suffixes meaning abnormal condition. Some suffixes have a general meaning of abnormal condition or disease. As an example, osis means an abnormal condition or disease. Gastrosis means any disease of the stomach. Gastro means stomach, and osis means abnormal condition. A word root, combining form, plus a suffix creates a new term. Tonsil O, tonsil, tonsils. Itis, inflammation. Tonsillitis, inflammation of the tonsils. Suffixes related to pathology. Pathology means the study of disease, and these suffixes describe specific disease conditions. Algia means pain and suffering. Gastralgia means pain in the stomach. Gastro means stomach, and algia means pain. Dynia also means pain. Gastrodynia refers to pain in the stomach. Gastro means stomach, and dynia means pain. Itis means inflammation. Gastritis is an inflammation of the stomach. Gastro means stomach, and itis means inflammation. Malacia means abnormal softening. Arteriomalacia is the abnormal softening of the walls of an artery or arteries. Arterio means artery, and malacia means abnormal softening. Notice that malacia is the opposite of sclerosis. Megaly means enlargement. Hepatomegaly is the abnormal enlargement of the liver. Hepato means liver, and megaly means enlargement. Necrosis means tissue death. Arterionecrosis means the tissue death of an artery or arteries. Arterio means artery, and necrosis means tissue death. Sclerosis means abnormal hardening. Arteriosclerosis is the abnormal hardening of the walls of an artery or arteries. Arterio means artery, and sclerosis means abnormal hardening. Notice that sclerosis is the opposite of malacia. Stenosis means abnormal narrowing. Arteriostenosis is the abnormal narrowing of an artery or arteries. Arterio means artery, and stenosis means abnormal narrowing. Suffixes, related to procedures. These suffixes identify a procedure that is performed on the body part, identified by the word root. Centesis is a surgical puncture to remove fluid for diagnostic purposes or to remove excess fluid. Abdominocentesis is the surgical puncture of the abdominal cavity to remove fluid. Abdomino means abdomen, and centesis means a surgical puncture to remove fluid. Ectomy means surgical removal. An appendectomy is the surgical removal of the appendix. Append means appendix, and ectomy means surgical removal. Graphy means the process of recording a picture or record. Arteriography is the process of recording a picture of an artery or arteries. Arterio means artery, and graphy means to record. Gram means record or picture. An arteriogram is the record produced by arteriography. Arterio means artery, and gram means record. Plasty means surgical repair. Myoplasty is the surgical repair of a muscle. Myo means muscle, and plasty means surgical repair. Scopy means visual examination. Endoscopy is the visual examination of the interior of a body cavity or organ by means of an endoscope. Endo means within, and scopy means visual examination. The double RRs. These suffixes, often called the double RRs, are particularly confusing. They are grouped here to help you understand the word parts and to remember the differences. Urge and regia mean bursting forth, an abnormal excessive fluid discharge or bleeding. Hemorrhage implies the loss of a large amount of blood in a short time. Hemo means blood and rage means bursting forth. Note: rage and regia refer to the flow of blood. Urhafi means to suture or stitch. Myrafi means to suture a muscle wound, myo means muscle, and rafi means to suture. As an aid to remembering this suffix, think of ir wrap as if you were going to wrap the injury in sutures. Arrhea means an abnormal flow or discharge and refers to the abnormal flow of most body fluids. Diarrhea is abnormally frequent loose or watery stools. Dia means through and rhea means abnormal flow. Note: although arrhea and arhage both describe an abnormal flow, they are not used interchangeably. Rhexis means rupture. Myorrhexis means the rupture of a muscle. Myo means muscle and hexis means rupture. As an aid to remembering this suffix, think of the X being ready to rupture and fly apart. Prefixes. A prefix is added to the beginning of a word to change the meaning of that term. Prefixes usually, but not always, indicate location, time, or number. The term natal means pertaining to birth, nat means birth, and al means pertaining to. The following examples show how a prefix changes the meaning of this term. And prenatal means the time and events before birth. Pre means before, nat means birth, and al means pertaining to. And perinatal refers to the time and events surrounding birth. Peri means surrounding, nat means birth, and al means pertaining to. This is the time just before, during, and just after birth. As postnatal means the time and events after birth. Post means after, nat means birth, and al means pertaining to. A prefix added to a word root, combining form plus a suffix, changes the meaning of the term. Pre before nat al, birth. Prenatal, the time and events before birth. Contrasting and confusing prefixes. Some prefixes are confusing because they are similar in spelling but opposite in meaning. Determining meanings based on word parts. When you know the meaning of the word parts, it is often possible to figure out the definition of an unfamiliar medical term. Taking terms apart. To determine a word's meaning by looking at the component pieces, you must first separate it into word parts. Most people like to start at the end of the word and work toward the beginning. And others like to start at the beginning of a word and work toward the end. And try it both ways. Then use the system that works best for you. As an example, look at the term otorhinolaryngology. It is made up of 3 combining forms plus a suffix. The word root, ot/o, means ear. The combining vowel is used because ot/o is joining another word root. The word root rhine, o, means nose. The combining vowel is used because rhine-o is joining another word root. The word root laryng-o means larynx and throat. The combining vowel is not used because laryng-o is joining a suffix that begins with a vowel. The suffixology means the study of, and together they form otorhinolaryngology, which is the study of the ears, nose, and throat. Oto means ear, rhino means nose, larynx means throat, and ology means study of. Because this is such a long name, this specialty is frequently referred to as ENT, ears, nose, throat, or shortened to otolaryngology, medical dictionary use. Learning to use a medical dictionary is an important part of mastering the correct use of medical terms. The following tips for dictionary use apply. Whether you are working with a traditional book-form dictionary or an electronic dictionary on your computer. The term prenatal refers to the events that occur before birth. Shown here is a diagram of the developing child in the uterus before birth, uterus umbilical cord fetus. The term perinatal refers to the time and events around birth. Shown here is a fetal monitor in use during labor. The term postnatal refers to the time and events after birth. Shown here is a newborn in a neonatal intensive care unit. Guessing at meanings. When you can guess at the meaning of a term based on the word parts that make it up, you must always double-check for accuracy, because some terms have more than one meaning. For example, look at the term lithotomy. Based on word parts, lithotomy means a surgical incision for the removal of a stone. Lithe means stone and otomy means a surgical incision. And however, lithotomy is also the name of an examination position in which the patient is lying on the back with the feet and legs raised and supported in stirrups. This possible confusion is only one of the many reasons why a medical dictionary is an important medical terminology tool. Contrasting and confusing prefixes. Al means away from, abnormal means not normal or away from normal. Ad means toward or in the direction of. Addiction means drawn toward or a strong dependence on a drug or substance. Dis means bad, difficult, painful. Dysfunctional means an organ or body part that is not working properly. Means good, normal, well, or easy. Euthyroid means a normally functioning thyroid gland. Hyper means excessive or increased. Hypertension is higher than normal blood pressure. Hypo means deficient or decreased. Hypotension is lower than normal blood pressure. Inter means between or among. Interstitial means between but not within the parts of a tissue. Intra means within or inside. Intramuscular means within the muscle. Sub means under, less, or below. Subcostal means below a rib or ribs. Supra means above or excessive. Supracostal means above or outside the ribs. A medical term may be taken apart to determine its meaning. Otorhinolaryngology, study of the ears, nose, and throat. OTO, ear, or hyn-o, nose. Laryngo, throat. Ology, study of. If you know how to spell the word. When starting to work with an unfamiliar dictionary, spend a few minutes reviewing its use guide, table of contents, and appendices. The time you spend here will be saved later when you are looking up unfamiliar terms. Based on the first letter of the word, start in the appropriate section of the dictionary. Look at the top of the page for clues. The top left word is the first term on the page. The top right word is the last term on the page. As next, alphabetically look for words that start with the first and second letters of the word you are researching. Continue looking through each letter until you find the term you are looking for. When you think you have found it, check the spelling very carefully, letter by letter working from left to right. Terms with similar spellings have very different meanings. When you find the term, carefully check all of the definitions. Guidelines to looking up unfamiliar terms if it sounds like it may begin with example. F. flatus, Ph. phlegm, G. gingivitis, J. jaundice, K. crepitus, C. cholera, K. kyphosis, Q. quadriplegia, C. cytology, P.S. psychologist, S. serology, Z. xeroderma, Z. zygote. And listen carefully to the term and write it down. If you cannot find the word based on your spelling, start looking for alternative spellings based on the beginning sound. Note: all of these examples are in this text. However, you could practice looking them up in the dictionary. Look under categories. Most dictionaries use categories such as diseases and syndromes to group disorders with these terms in their titles. As examples, venereal disease would be found under disease, venereal. These are sexually transmitted diseases. Fetal alcohol syndrome would be found under syndrome, fetal alcohol. When you come across such a term and cannot find it listed by the first word, the next step is to look under the appropriate category. Pronunciation. A medical term is easier to understand and remember when you know how to pronounce it properly. To help you do this, each new term in the text is identified in bold, followed in parentheses by a commonly accepted pronunciation, and then the definition. In this sounds like pronunciation system, the word is respelled using normal English letters to create familiar sounds. To pronounce a new word, just say it as it is spelled in the parentheses. The part of the word that receives the primary, most emphasis when you say it is in capital letters and bold. For example, edema means excess fluid in body tissues, causing swelling. If a part of the word receives secondary emphasis when you say it, this is in lowercase letters and bold. For example, appendicitis means an inflammation of the appendix. Appendic means appendix and itis means inflammation. A word of caution. Frequently, there is more than one correct way to pronounce a medical term. The pronunciation of many medical terms is based on their Greek, Latin, or other foreign origins. However, there is a trend toward pronouncing terms as they would sound in English. The result is having more than one correct pronunciation for a term. In the text, sometimes an alternative pronunciation is included to reflect these changes. And both are correct, and the difference is a matter of preference. However, your instructor will tell you which pronunciation to use in your course. Spelling is always important. Accuracy in spelling medical terms is extremely important. And changing just one or two letters can completely change the meaning of a word, and this difference literally could be a matter of life or death for the patient. The section Look-alike, Sound-alike Terms and Word Parts. Later in this chapter will help you become aware of some terms and word parts that are frequently confused. Abbreviations are frequently used as a shorthand way to record long and complex medical terms, and Appendix B contains an alphabetized list of many of the more commonly used medical abbreviations. Abbreviations can also lead to confusion and errors. Therefore, you must be very careful when using or translating an abbreviation. For example, the abbreviation BE means both below elbow and barium enema. Just imagine what a difference a mix-up here would make for the patient. And because the same abbreviation may have more than one meaning, it is important that you be very careful when using or translating an abbreviation. To be safe, always follow the rule. When in doubt, spell it out. Singular and plural endings. Many medical terms have Greek or Latin origins. As a result of these different origins, there are unusual rules for changing a singular word into a plural form. Additionally, English endings have been adopted for some commonly used terms. Table 16 provides guidelines to help you better understand how these plurals are formed. Also, throughout the text, when a term with an unusual singular or plural form is introduced, both forms are included. For example, a phalanx, phalanx, is one bone of the fingers or toes, figure 18, plural phalanges. A phalanx is one finger or toe bone. Two or more of these bones are called phalanges. Phalanges, plural. Phalanx, singular. 1. If the term ends in A, the plural is usually formed by adding an E. Bursivertebra, singular. Bursivertebrae, plural. 2. If the term ends in X or IX, the plural is usually formed by changing the X or IX to itis. Appendix index, singular. Appendices indices, plural. 3. If the term ends in is, the plural is usually formed by changing the is to s. Diagnosis metastasis, singular. Diagnoses metastases, plural. 4. If the term ends in itis, the plural is usually formed by changing the is to ids. Arthritis meningitis, singular. Arthritides metastases, plural. 5. If the term ends in nx, the plural is usually formed by changing the x to gs. Phalanx meninx, singular. Phalanges meningitis, plural. 6. If the term ends in on, the plural is usually formed by changing the on to a topos e. Pons. Criterion ganglion, singular. Criteria ganglia, plural. 7. If the term ends in the plural usually is formed by changing the to a diverticulum ovum, singular. Diverticula ova, plural. 8. If the term ends in us, the plural is usually formed by changing the us to in. Alveolus malleolus, singular. Alveoli malleoli, plural. If you are in doubt as to how a plural is formed, look it up in a medical dictionary. Basic medical terms. The basic medical terms used to describe diseases and disease conditions are shown in Table 17. Look-alike, sound-alike terms and word parts. One confusing part of learning medical terminology is dealing with words and word parts that look and sound so much alike. This section highlights some frequently used terms and word parts that you may find most confusing. Pay particular attention to these terms and word parts as you encounter them in the text. Artery O, either O and arthur O. Artery O means artery. End arterial means pertaining to the interior or lining of an artery. End means within. Artery means artery, and al means pertaining to. Aether O means plaque or fatty substance. An atheroma is a fatty deposit within the wall of an artery. Ather means fatty substance and oma means tumor. Arthro means joint. Arthralgia means pain in a joint or joints. Arthur means joint and algia means pain. Ileum and ilium. The ileum is part of the small intestine. Remember ileum with an E as in intestine. And the ilium is part of the hip bone. Remember ilium with an I as in hip. Infection and inflammation. An infection is the invasion of the body by a pathogenic, disease-producing organism. The infection may remain localized or be systemic, affecting the entire body. Inflammation is a localized response to injury or destruction of tissues. The cardinal signs, indications of inflammation are 1. Redness, erythema, 2. Heat, 3. Swelling, edema, and 4. Pain. These are caused by extra blood flowing into the area as part of the healing process. The suffix itis means inflammation. However, it is also often used to indicate infection. Laceration and lesion. A laceration is a torn, ragged wound. A lesion is a pathologic change of the tissues due to disease or injury. Mucus and mucus. Mucus is an adjective that describes the specialized mucous membranes that line the body cavities. Mucus is a noun and is the name of the substance secreted by the mucous membranes. Basic medical terms. A sign is evidence of disease such as fever that can be observed by the patient and by others. A sign is objective because it can be evaluated or measured by others. A symptom such as pain or a headache can only be observed by the patient. A symptom is subjective because it can be evaluated or measured only by the patient. A syndrome is a set of signs and symptoms that occur together as part of a specific disease process. Diagnosis is the identification of the disease. Diagnosis is the process of reaching a diagnosis, plural diagnoses. A differential diagnosis attempts to determine which one of several diseases may be producing the symptoms. Prognosis is a forecast or prediction of the probable course and outcome of a disorder, plural prognoses. An acute disease or symptom has a rapid onset, a severe course, and a relatively short duration. A chronic disease or symptom has a long duration. Although they may be controlled, such diseases are rarely cured. A remission is the partial or complete disappearance of the symptoms of a disease without having achieved a cure. A remission is usually temporary. Some diseases are named for the condition described. For example, chronic fatigue syndrome, CFS, is a persistent, overwhelming fatigue that does not resolve with bed rest. An eponym is a disease, structure, operation, or procedure, named for the person who discovered or described it first. For example, Alzheimer's disease is named for Alois Alzheimer, a German neurologist who lived from 1864 to 1915. An acronym is a word formed from the initial letter or letters of the major parts of a compound term. For example, the acronym LASER stands for light amplification by stimulated emission of radiation. Myco, myelo, and myco means fungus. Mycosis means any disease caused by a fungus. MIC means fungus and osis means abnormal condition. Myelo means bone marrow or spinal cord. Myelopathy is any pathologic change or disease in the spinal cord. Myelo means spinal cord and pathy means disease. And myo means muscle. Myopathy is any pathologic change or disease of muscle tissue. Myo means muscle and pathy means disease. Ologist and ology. Ologist means specialist. A gerontologist is a specialist in diagnosing and treating diseases, disorders, and problems associated with aging. Geront means old age and ologist means specialist. Ology means the study of. Neonatology is the study of disorders of the newborn. Neo means new, nat means birth, and ology means study of. Ostomy and otomy. Ostomy, which is also used alone as a noun, means to surgically create an artificial opening. A colostomy is the surgical creation of an opening between the colon and the body surface. Col means colon and ostomy means an artificial opening. Otomy means cutting into or a surgical incision. A colotomy is a surgical incision into the colon. Col means colon and otomy means a surgical incision. Palpation and palpitation. Palpation is an examination technique in which the examiner's hands are used to feel the texture, size, consistency, and location of certain body parts. Palpitation is a pounding or racing heart. Prostate and prostrate. The prostate refers to a male gland that lies under the urinary bladder and surrounds the urethra. Prostrate means to collapse and be lying flat, or to be overcome with exhaustion. Pile-o, pio, and piro. Pile-o means renal pelvis, which is part of the kidney. Pyelitis is an inflammation of the renal pelvis. Pile means renal pelvis and itis means inflammation. Pio means pus. Pyoderma is any pus-producing disease of the skin. Pio means pus and derma means skin. Pyro means fever or fire. Pyrosis, also known as heartburn, is discomfort due to the regurgitation of stomach acid upward into the esophagus. Pyre means fever or fire, and osis means abnormal condition. Supination and suppuration. Supination is the act of rotating the arm so that the palm is forward or upward. It also means the act of assuming the supine lying down position. Suppuration is the formation or discharge of pus. Suturing and ligation. Suturing is the act of closing a wound or incision by stitching or a similar means. Ligation is the act of binding or tying off blood vessels or ducts. Triage and trauma. Triage is the medical screening of patients to determine their relative priority of need and the proper place of treatment. For example, emergency personnel arriving on an accident scene must identify which of the injured require care first and determine where they can be treated most effectively. A trauma means wound or injury. These are the types of injuries that might occur in an accident, shooting, natural disaster, or fire. Viral and virile. Viral means pertaining to a virus. Vir means virus or poison, and al means pertaining to. Virile means possessing masculine traits.